Now to our GMA cover story. New research on Wegovy finding that patients continually taking the medication maintained weight loss after 4 years. ABC News medical correspondent Dr. Darien Sutton, our dear friend, joins us now with What to Know. Good morning. So great to have you. Okay, so this study, does that mean that they had to take it for those 4 years to keep that weight loss?
Yes, so this study comes from Novo Nordisk, the maker of Wegovy. Important disclaimer, but still peer-reviewed nonetheless. And it was the longest study to date. They followed these patients with overweight status or obesity, also dealing with underlying heart disease. And they found, Janae, that the majority of that weight loss, approximately on average 10%, was lost in the first 15 months, and it was sustained and kept off for 4 years. So this is the longest study to date answering that question. When the weight comes off, does it stay off?
Okay, and here's a big question a lot of people are asking, and maybe this study lends something to it. Like what does this tell us about using this drug long term?
You know, we're still waiting for the ongoing data collection, basically looking at 10, 20 years in the terms of weight loss. This medications and this group of medications has been studied before, mainly for the beginning when it started for diabetes. And now we're seeing expanding indications, expanding uses. And we're also paying attention to the adverse effects. For example, the most common symptom, it seems, was nausea, which approximately 17% of patients withdrew because of that.
And we are seeing more and more headlines on all of these weight loss drugs. Is this changing how we look at obesity now?
Gio, I hope so. You know, obesity and the status of being overweight, I think we should look at it as a diagnosis. And I think regardless of how much someone diets or exercises, we all lose weight differently. We all gain weight differently. We all hold weight differently, mainly due to the complex metabolic process that's associated with that factor. So I think as we step down the line of understanding obesity, we step away from shame and stigma and step toward the realization that this is a huge breakthrough that can help likely millions of people while keeping a critical eye, and of course, on the adverse and the risks that come with it.
And this being a breakthrough, and we're hearing so much more about it, so it really is shifting the conversation. But what happens, because folks need to know, if they do stop taking the medication, does that impacts how that weight stays off, right?
Absolutely. Unfortunately, again, the obesity itself is a chronic condition, meaning just like other diagnoses of hypertension or high blood pressure and diabetes, when you stop the treatment, you'll likely get the symptoms back. So unfortunately, we're seeing that. In terms of whether or not patients can taper it down or decrease it or maybe skip doses, we're still trying to understand that benefit.
Because we're learning as we're going along, right?
Absolutely.
New to these studies. Thank you so much,
Of course.
Dr. Sutton.